Hey, Alpha Nurses, I'm Licensure from alphanursesguy.com. These are NCLEX practice questions. Without delay, let's get started.
A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client 1. Has improved circulation in the legs, 2. Can wiggle the toes, 3. Is urinating more frequently, 4. Is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome. The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing, 2. Jogging, 3. Golfing, 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body. A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time. A client with peripheral vascular disease has bypass surgery. The primary goal of the plan of care after surgery is to 1. Maintain circulation, 2. Prevent infection, 3. Relieve pain, 4. Provide education. The correct answer is 1. Maintaining circulation in the affected extremity after surgery is the focus of care. The graft can become occluded, and the client must be assessed frequently to determine whether the graft is patent. Preventing infection and relieving pain are important, but are secondary to maintaining graft patency. Education should have taken place in the preoperative phase, and then continued during the recovery phase. A client with peripheral vascular disease has chronic, severe pretibial and ankle edema bilaterally. Because the client is on complete bed rest and circulation is compromised, one goal is to maintain tissue integrity. Which of the following interventions will help achieve this outcome? 1. Administering pain medication. 2. Encouraging fluids. 3. Turning the client every 1 to 2 hours. 4. Maintaining hygiene. The correct answer is 3. The client is at greater risk for skin breakdown in the lower extremities related to the edema and to remaining in one position, which increases capillary pressure. Turning the client every 1 to 2 hours promotes vasodilation and prevents vascular compression. Administering pain medication will not have an effect on skin integrity. Encouraging fluids is not a direct intervention for maintaining skin integrity, although being well hydrated is a goal for most clients. Maintaining hygiene does influence skin integrity, but is secondary in this situation. The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? 1. Give the report face-to-face with both nurses in a quiet room. 2. Audio tape the report for future reference and documentation. 3. Use a printed checklist with information individualized for the client. 4. Document essential transfer information in the client's electronic health record. The correct answer is 3. Using an individualized, printed checklist ensures that all key information is reported. The checklist can then serve as a record to which nurses can refer later. Giving a verbal report leaves room for error in memory. Using an audio tape or an electronic health record requires nurses to spend unnecessary time retrieving information. The nurse is assessing a client with heart failure who is receiving home health care monitoring using electronic devices, including scales, blood pressure monitoring, and structured questions to which the client responds daily on a touchscreen monitor. The nurse reviews data obtained within the last 3 days. The nurse calls the client to follow up. The nurse should ask the client which of the following first. 1. How are you feeling today? 2. Are you having shortness of breath? 3. Did you calibrate the scales before using them? 4. How much fluid did you drink during the last 24 hours? The correct answer is 2. The client has gained 5 pounds in 3 days with a steady increase in blood pressure. The client is exhibiting signs of heart failure, and if the client is short of breath, this will be another sign. Asking how the client is feeling is too general, and a more focused question will quickly determine the client's current health status. The scale should be calibrated periodically, but a 5 pounds weight gain, along with increased blood pressure, is not likely due to problems with the scale. The weight gain is likely due to fluid retention, not drinking too much fluid. Which activity would be appropriate to delegate to an unlicensed personnel for a client diagnosed with a myocardial infarction who is stable? 1. Evaluate the lung sounds. 2. Help the client identify risk factors for coronary artery disease. 3. Provide teaching on a 2-gram sodium diet. 4. Record the intake and output. The correct answer is 4. Unlicensed personnel are able to measure and record intake and output. The nurse is responsible for client teaching, physical assessments, and evaluating the information collected on the client. The nurse is preparing to defibrillate a client on a cardiac monitor who is in ventricular fibrillation. See the photo. The nurse should do which of the following? 1. Move the paddle in the nurse's left hand to the midline. 2. Move the paddle in the nurse's right hand to above the client's nipple. 3. Grasp the handles of the paddles to allow visibility of the black markings on the paddle. 4. After pressing the charge button and calling all clear, push the shock button. The correct answer is 4. The paddles are in the correct position. The nurse can push the shock button to defibrillate the client. When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically. 1. Above the umbilicus. 2. At the level of the xiphoid process. 3. Over the victim's mid-abdominal area. 4. Below the xiphoid process and above the umbilicus. The correct answer is 4. The thrust should be delivered below the xiphoid process, but above the umbilicus, to minimize the risk of internal injuries. The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without cardiopulmonary function and still not experience permanent brain damage is 1 to 2 minutes, 2 4 to 6 minutes, 3 8 to 10 minutes, 4 12 to 15 minutes. The correct answer is 2. After a person is without cardiopulmonary function for 4 to 6 minutes, permanent brain damage is almost certain. To prevent permanent brain damage, it is important to begin CPR promptly after a cardiopulmonary arrest. If a client is receiving rescue breaths and the chest wall fails to rise, during cardiopulmonary resuscitation, the rescuer should first 1. Try using a bag mask device. 2. Decrease the rate of compressions. 3. Intubate the client. 4. Reposition the airway. The correct answer is 4. If the chest wall is not rising with rescue breaths, the head should be repositioned first to ensure that the airway is adequately opened. A bag mask device allows for delivery of 100% oxygen, but is difficult to manage if there's just one rescuer. Ideally, 2 persons are used to operate the bag mask device, one to maintain the seal, and the other to provide the ventilations. Compression should be maintained at 100 per minute. During cardiopulmonary resuscitation, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs will be most likely at risk for laceration by forceful compressions over the xiphoid process? 1. Lung. 2. Liver. 3. Stomach. 4. Diaphragm. The correct answer is 2. Because of its location near the xiphoid process, the liver is the organ most easily damaged from pressure exerted over the xiphoid process. During CPR, the pressure on the victim's chest wall should be sufficient to compress the heart, but not so great as to damage internal organs. Injury may result, however, even when CPR is performed properly. A client who has been given cardiopulmonary resuscitation is transported by ambulance to the hospital's emergency department, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the 1. Pulse rate is normal. 2. Pupils are reacting to light. 3. Mucous membranes are pink. 4. Systolic blood pressure is at least 80. The correct answer is 2. Pupillary reaction is the best indication of whether oxygenated blood has been reaching the client's brain. Pupils that remain widely dilated and do not react to light probably indicate that serious brain damage has occurred. The pulse rate may be normal, mucous membranes may still be pink, and systolic blood pressure may be 80 or higher, and serious brain damage may still have occurred. The nurse observes a cardiac rhythm. See the image below for a client who is being admitted with a myocardial infarction. What should the nurse do first? 1. Prepare for immediate cardioversion. 2. Begin cardiopulmonary resuscitation. 3. Check for a pulse. 4. Prepare for immediate defibrillation. The correct answer is 3. The nurse should first check the client for the presence of a pulse. The presence of a pulse determines the treatment for ventricular tachycardia. It is also important to assess the client's heart rate and level of consciousness. Cardioversion may be used to treat hemodynamically unstable tachycardias. Assessment of instability is required before cardioversion. It is not appropriate to begin CPR unless the pulse is absent. Defibrillation is used to treat ventricular fibrillation or pulseless ventricular tachycardia.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.